Hello and welcome to the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith and I'm here with Incident Manager Dr. Stewart Kennedy. And Dr. Kennedy, we actually have a bit of an alert today as opposed to a report. Things have changed very rapidly. We've seen a big jump in numbers in our community of positive COVID-19 cases. In fact, we're now at 23 cases. What does that mean here at our hospital?
So I'm very concerned with the rapid rise. I mean, last week at this time, we had basically 0, and now we have 23. So that's concerning, and certainly it represents the prevalence in the community. And when the prevalence has increased, that means there's more COVID-19 in the community, and we have to take extra precautions to ensure that we're protecting our patients and our staff and our professional staff here in the hospital. So we met this morning as an IMS team to review all our restrictions once again that we had implemented in March and April and May, and then we had sort of eased up some of the restrictions over the summer months. But now, as of after a meeting, and although we have still no active cases of COVID-19 in the hospital, which is very good, we really feel that we have to reinstate some of our measures to restrict visitations. So effective Wednesday, which is tomorrow, November 1st, November 11th, care partners are not permitted into this hospital. And those are the care partners we allowed from 5 in the afternoon to 8 to help assist with the patients. We're still going to allow essential care partners into the hospital, and those are defined as a patient care partner who a patient is dying and death is imminent within 72 hours. Certainly a patient who's under 18 years of age, any patients undergoing surgery, women who are giving birth, outpatient individuals who require assistance, any patient who requires communication needs. So we're still going to have essential care partners welcome into the facility. We're just limiting care partners at this point in time. And that's very, very important to really limit the flow, the unnecessary flow of people throughout the hospital, because there's an increase of COVID-19 in the community.
So why is that so important here in Thunder Bay? You don't see the same level of restrictions at all hospitals.
You know, I take a lot of criticism, our team takes a lot of criticism because we are more aggressive with some of these restrictions than others. But as we've said many, many times, that we need to really protect this hospital at a higher degree than many other hospitals in other areas, because there's only one acute care facility here in Thunder Bay. And remember, we are continuing with our surgery. We are continuing with our diagnostics because we do not want to go backwards and create another backlog. So on top of the measures we're putting in place, we're continuing to actually deal with our backlog of patients with our diagnostics as well as our surgery, and that's so important. So we have an increased flow now because we have more patients coming in for services, so we look at how and who we can limit into this hospital. We are also looking at volunteer restrictions. We're also looking at medical learner restrictions, and we'll have further discussions with our IMS as we move forward. And starting on Thursday, which is November the 12th, we are going to limit our volunteer activity also. We still need and want volunteers, but we're going to limit the amount of volunteers we have in the hospitals, more just for the essential programs.
So I just want to go back to a couple of things there. One, with the visitor restrictions, we know that this can be really difficult. It was a challenging decision for the incident management team. It's really important to note that there are alternatives, right? What can we do for patients who will be missing visits from family members?
Well, we're hoping the patients will have access to their personal devices, you know, with their iPhones as well as their iPads. If not, we will supply them for them. We encourage virtual visits. We're all getting used to virtual meetings and virtual visits, so it's a good modality of communication. We're also encouraging regular conversation with the primary caregivers of your loved ones at the hospital. So we'll do all we can to communicate with the family who are unable to actually come and spend time with their loved ones in the hospital.
Okay, and so as you said, it's really critical that we limit as much as we can anybody coming into this facility, because the last thing we want is any kind of shutdown due to an outbreak in our hospital. There is no other hospital just down the road. So what about hospital staff? Are there any changes being made to internal policies?
As far as we're looking at revisiting our policy about having staff work remotely, if they can, and we're also, as we said last time, we're also we're not recommending travel for our staff. In fact, I don't think people in Thunder Bay should even travel outside of Northern Ontario because many of the cases that we've had in the community are related to travel. And so certainly if we can limit travel outside of Northern Ontario, not bring COVID-19 back to Northern Ontario, I think our ability to deal with COVID-19 and the increasing prevalence of COVID-19 is better managed. So right now, if you do have to travel, essential travel, I think it's very, very important when you do come back. We've outlined in one of our policies for our staff that when you travel outside of Northern Ontario, you have to go through our Occupational Health Department for approval of that travel. If it's deemed essential and you're deemed an essential worker, we can do priority sort of testing and get them back to work. But if you're not deemed essential, but you still have to go for that travel, we encourage our staff, we ask our staff to stay at home for 7 days. If they have no symptoms, return. Certainly, I think other employers in the city, as well as other sort of individuals, should take their own initiative. If they're traveling outside Northern Ontario, when they come back, if they have the opportunity, it'd be great if they could stay 7 days away from the work environment and then only return if they have no symptoms.
Absolutely. Okay. So we're not anticipating any other changes in the next couple of days, or?
We're going to revisit with IMS. We're looking at our medical learners, and we're going to see if we need to restrict our medical learners in this building. I mean, we have hundreds of medical learners in the building that we may have to consider, but it's important that our medical learners continue to experience an education at the healthcare facility because they're our future workers. So we really take, we look at that very, very sort of strategically to see if we need to sort of limit learners at this point in time. And we're looking at contractors come into the building. We're looking at anybody who comes into this building right now who are not essential. We're taking a serious look at whether they actually bring they need to be here.
So a lot of our next steps really depend on what is happening in the community, in the prevalence of COVID-19 in the community. So what would you like to say to community members at this time?
Now more than ever, you really want to limit your gatherings. If you are gathering, follow the rules, making sure I think it's 10 indoor, 25 outdoor. But when you still have your gatherings, wear your mask. Stay your 2 meters distance, wash your hands, and really be cognizant of that the next person beside you could have or had been exposed to COVID-19. So you really have to think about that at all times.
Okay. Thank you, Dr. Kennedy. I know it's not always easy making these difficult decisions. So we will keep the community posted of any new limitations, changes to our processes. But for now, we want to, I think, stress that anyone who needs urgent care will always safely receive it here at our hospital. Thank you for tuning in. Stay safe.